The hypoglossal nerve controls muscles in the tongue and helps with swallowing and speaking. In obstructive sleep apnea, the muscles of the tongue and throat relax, which can block the airway and reduce airflow. The hypoglossal nerve stimulator is an implanted device that helps activate the hypoglossal nerve during sleep to move the tongue, open the upper airway, and reduce sleep apnea. To determine if you're a candidate for this implant surgery, you may need an updated sleep study, and you will need to meet with a sleep surgeon and have a drug-induced sleep endoscopy exam. The implant surgery is done under general anesthesia. The device and breathing sensor are implanted in the right upper chest under the skin. The implant is connected to a wire with an electrode that is placed around the hypoglossal nerve through an incision on the neck under the chin. Most patients are able to go home the same day after surgery. You will follow up with your doctor after surgery to check on healing and get the implant working well. 1 month after surgery, the implant is turned on. At this time, you will receive a remote control that you will use to turn on the implant every night before you go to sleep. You will work with your doctor to adjust and find the correct level settings for your implant. It can take a few weeks to months to get used to using the device, and a sleep study is typically done 2 to 3 months after you've been using the implant every night. The sleep study is used to determine the best implant settings for your sleep apnea. Risks of hypoglossal nerve stimulation surgery include infection, bleeding, dislodgement of the device, need for implant replacement, injury to surrounding structures including the lining of the lung, and injury to the nerve that controls the tongue and lower lip. There's also the risk that the implant will not effectively treat your sleep apnea, or that it is difficult for you to use. The battery in the implant lasts about 10 years, and at that time, the main implant can be replaced through the lower chest incision. The current implant does not allow for many types of MRI scans to be done. You will not be allowed to have MRI exams that include the shoulder, body, hips, or spine. There are no issues with air travel security with this implant. Talk with your doctor about whether you are a potential candidate for hypoglossal nerve stimulation surgery and what to expect with implant use.